Hi, Dr. King.
Hi, Darryl.
Hi, thanks for doing the conference. I'm totally grateful for you to be here to talk about genomics and such. Can you tell us what kind of doctor you are and what space you work in, what kind of things you do?
Sure. So I have a PhD in molecular biology, and then I trained in what's called translational oncology. So really trying to understand the biology behind cancer and then work on therapeutics, different kinds of drugs that target the cancer in smart ways based on what the cancer looks like. After that, I actually moved over to the nonprofit world, and now I'm the chief scientific officer for GO2 Foundation for lung cancer. So I lead our research portfolio. I help communicate new and exciting science to our patient community in the lung cancer space, and do a variety of projects across the board, including collaborate with groups in other cancers like yours.
Right. And, aside from, the niceties of collaboration, you are one of the, major thinkers and speakers on genomics and such. And at least in my view, you are certainly. I'm just grateful that you could be here to talk to our audience. Let's start by just differentiating genetics, genomics, DNA, RNA, all these things, like in 90 seconds or less, just so we have the vocabulary to continue talking about this stuff.
Sure, absolutely. So when most people are talking about genetics, they're talking about inherited genetics. So if you think about the DNA that you got passed from your parents to you, that really is inherited generation to generation, can affect your cancer risk in that way. When we're talking about genomics, we're usually talking about the changes that happen in our case, in the cancer cell, which can be DNA changes that happen over the course of your life, but they can also be other changes. They can be RNA, which is made from DNA, or even sometimes we see changes in the DNA and how it's structured and how it's affected that weren't inherited changes. So genomics is a much more all-encompassing term to understand what's happening to in our case, the cancer cells.
Right. And when we talk about changes, everything changes. There are good changes, there are passive or structural or okay or expected changes, and then there are the bad ones which make up the cancer world.
Correct.
So, right. So within our discussions, both in our support groups and just in real life with doctors, people wonder, like, what did I do to get prostate cancer? How does genomics help us understand that?
So generally, there isn't anything you did to get cancer. We, in the lung cancer space, we have a major saying called "No one deserves to die." It doesn't matter what you did and the risk factors behind it. Cancer is a combination of a lot of things and affects people differently. You're exactly right the way you talked about the changes. Changes happen over the course of somebody's life. No matter what we're doing every day is causing different changes to happen to the cells inside our body. Now, sometimes those changes don't do anything and we would never know the difference. But part of the reason that cancer tends to happen in older people is that you accumulate more and more changes over time. Age is actually the biggest risk factor for cancer across all cancers because of that timing. And inevitably, at some point, you may get a change that negatively affects something in your body. When that change actually activates cells to grow and divide and grow fast, that's what ends up leading into cancer, when you get multiple changes that cause that growth. So it's really, it's not something you did. People take it too directly like that. It's really a combination of things that add up over time. And as we all know, there are things that can increase your risk, especially of certain types of cancer, but that just gives you a higher likelihood of more of these changes. It doesn't mean that, yes, you're going to get cancer, no, you're going to get cancer, or it's your fault for doing that.
Yeah, but okay, so I could hear like 1,000 people, like, I could feel the air rushing up as they raise their hand saying, well, wait a minute, if there are things that might increase the opportunity for change or the likelihood or the the risk for change or whatever in a toxic way, in a negative way. That sort of implies that there are things I could do to prevent that.
Yes, I mean, and most of them, right? I obviously come from the lung cancer space. Smoking is a big point of discussion in our world. Smoking is known to cause certain types of changes, certain transitions in your DNA, just like all the other changes. Sometimes those are harmful and sometimes those are not. It's not a one-to-one that everybody who smokes heavily ends up with cancer. Some people who have never smoked get lung cancer. That's actually not very well known, that we see about 20% of our population never smoked. It's actually an increasing problem in young females. And people are shocked. I never did anything. But while the smoking increases your risk, it's not a one-to-one. Obviously, prevention is key. We don't want people to be smoking. We want to help people reduce and quit. In the prostate cancer space, it's the same thing. You want to minimize your risk factors as much as you can, exercise, eat healthy, all the things that that could potentially keep your body healthy and lower your risk. We see the same thing in skin cancer with melanoma. You want to limit your sun exposure. So it's important to think about staying healthy and preventing cancer as much as you can. That's a huge component. But it's not, unfortunately, you don't always have the answer. You can't keep yourself from getting cancer always, no matter what you do.
Right. So like there are, in fact, day-to-day, activities of daily life kind of things that influence, genomic likelihood for cancer. But, in a practical way, you can't, it's the rare person who will go whole hog into, protecting themselves and putting themselves in a cancer-free bubble. And even then, you don't know whether you're doing something correct because we actually don't know, for certain what those, environmental risks may or may not be. But before we continue, just while you mentioned smoking, does smoking influence prostate cancer onset?
It
Tobacco
definitely
use,
increases
yeah.
your risk for a number of cancers. Prostate is not the highest on the list, but there's lung, throat. We see a lot of bladder cancer. But my general feeling is, yes, it does cause these DNA changes. It does impact risk in general of many kinds of cancer. So I would also advocate for prostate cancer, for people who are worried about prostate cancer, to reduce or quit smoking if possible.
Yeah, and don't smoke in my apartment is
Correct.
basically
That
my
too.
response. Not even on the terrace.
My kids would tell you that I advocate you don't smoke anywhere near any of us. But I also understand that smoking is an addiction. It was presented to many people many years ago as the cool thing to do. It's hard to overcome that sometimes, and there's lots of ways to help. That's a whole different conversation. But
yeah. Let's put hold on to the environmental stuff for a second. How does stuff from the outside world, beyond our skin, get influence stuff in our body at a genomic DNA RNA level? And how does it, and how does it influence it in such a dynamic way that it screws up things to give us cancer?
There's a lot of different possibilities. Kind of from a big picture level, you think about that you are taking in many things throughout the day. You mentioned skin, you're taking in light, you're taking in exposures through your skin. You're also breathing in the air. You're also eating different foods, drinking things. All of that brings potential exposures into your body. Once things are in your body, they're in contact with your cells. We talked about DNA making RNA. RNA then makes proteins, and your cells are filled with different kinds of proteins that do different things. And some of them will react to the things that are in your bodies. A great example is, when you are exposed to a bacteria or a virus, it activates your immune system within your body to go fight those things. different cells in your bodies will react. So that will cause changes. It will cause things like that. We also, once things enter your body, there's ways that it can affect the DNA repair processes too. So DNA repair is really important. These changes happen all the time. Your body has cells normally that will actually, proteins within the cells that will help repair the DNA, check it and make sure it's going properly, but it doesn't always. It can still miss that. It can still make mistakes. So there's a number of ways that those environmental factors can affect you. I think the challenge with a lot of the science and understanding the environmental risk is it's so hard to do the studies, and a lot of it is really not black or white. You know, we don't know what level of certain exposures is what would cause these genomic changes in your cells. We know things are probably bad for you. We know, you know, things like exercise and eating healthy are good, but there's not always a exact line of you can't have this much of this exposure. So it's challenging because you need so many people and they all live different lives and have different risk levels in different ways. But everything can potentially add up to affect the cells in your body.
And the adding up is interesting because it's not just quantity, there's a temporal aspect to it, you know, how long you're exposed. So, you know, like with prostate cancer, do we have any idea whether things that we were exposed to when we were infants on up, you know, in grade school, you know, and whatever anyone, I mean, let your imagination, to my audience, let your imaginations run wild with what you were exposed to as a kid. You know, could those have been the times that got our prostate cancer going, rather whatever we're doing as adults?
Absolutely. As I mentioned before, a lot of times it takes multiple hits. They used to call it the two-hit hypothesis, multiple hits in your DNA to really activate enough growth-causing genes to start the cancer. Some of those easily could have happened years and years and years ago, and you were just never aware until later when another hit happened that then allowed it to really start growing into the cancer. So exposures over the course of our lives can definitely add up.
Right. And we see throughout the world these little pocket, you know, these cancer zone things. Is there a better phrase than cancer zone, or it's just cancer zone? Or
okay, that works. I mean,
okay.
I think you know, high exposure areas. There's different
Hot zones. That's what I was thinking.
hot zones. Okay.
Yeah. Okay. So that's a cooler way to describe it, I guess. Okay. So you've got hot zones for cancer. And the implication of that, you know, and those are just identified by, you got a lot more people with a particular cancer showing up and, you know, within that geographic circle or area than someplace else or someplace adjacent to it, you know. The implication is there's something in the ground, something in the food, something in something that's causing that at an elevated state. What do we know now? What in 2020 going into 2021, in the world of oncology, have we been able to identify anything from those hot zones that say that's causing cancer, keep away?
That's a great question. I think there are examples of it, but I don't think we know enough, or probably a lot. You know, I think there are known examples from specific hot zones where they saw, you know, for example, an increase in leukemias or an increase in something that was directly related to some type of exposure. You can see plants or contaminated water or things like that. So there are known examples, but there's also a lot of gray area. To again use a lung cancer example, sorry, it is what I live every day, so the examples pop in my head from there. Radon is an interesting one. There's very good data that coal miners who were exposed to extremely high levels of radon are at much higher risk for getting lung cancer. It's the second highest risk factor beyond smoking is these high exposures of radon. Now, there's people who totally believe that their lung cancer is caused by high radon levels in their home, in their work. It's something that needs to be monitored. But that's where the science really is behind, unfortunately, for all of us. It's very hard to find that line of how much of an exposure to something like radon or an environmental toxin from somewhere in your community is too much that it puts you over a risk threshold that you're really at much higher risk. I think there's a lot of research still to be done, you know.
Yeah.
Science is great, but there's always more questions and always more to learn. And unfortunately, I think with a lot of the environmental exposures, we're still learning.
Yeah, and this might be a 15 seconds for a plug to donate to Malecare and to go to for research in both prostate and lung cancer, anything else. Malecare.org/donate. The idea, but the corollary to the hot zones is there are blue zones, places where people live forever, or to, you know, in their hundreds, and rarely have cancer presentations. Do we know anything from those blue zone studies that tell us what's really, really good to do?
That's a good question. I'm not sure I actually have seen a lot of those. So I'm not positive. It seems like often those are kind of people here and there, and there's high interest in, you know, can we find the gene or whatever that'll help us all live forever and not get anything, not come down with anything. But to my knowledge, I haven't seen anything really definitive on that, but I wouldn't say I'm an expert on that particular question.
Yeah, and you know, I mean, when I was in college, the Hunza people were studied, and I read a lot about them, and they were great at baking bread in a unique way. So my friends and I, you know, who we lived in a house slightly off campus, we'd bake Hunza bread, you know, till like, you know, we couldn't find flour anywhere outside of Philadelphia, you know, so it was like, where's the Hunza, you know, and you know, it didn't really turn out the way we would like. You know, there are berries in Peru that people until very recently thought were anti-carcinogenic in you know, in a really powerful way. And you know, the blue zones. I mean, everyone talks about the Mediterranean diet, and when I say everyone, it's not just a cliche phrase. It's literally everyone with an MD or LCSW after name, or anyone, you know, Mediterranean diet. What's the truth or reality, or you know, around that in terms of genomic influence?
Um, so it's a more complicated question. You know, the Mediterranean diet's not a cure-all, right? It's not, if you eat this diet, you are never going to come down with any type of cancer. That being said, I referenced earlier, you know, eating healthy and exercising are definitely positives. And the Mediterranean diet is one good method of eating healthy. I think it involves ingesting less things that could be carcinogenic, so less chance of really altering your genome through exposure. And also, you know, a lot of healthy things that are good for your body to help fight off, you know, bad things from outside, bacteria, viruses, stuff like that. So there is definitely data that lends support to eating healthy, exercising, keeping your body healthy helps tip your risk in a positive way. Again, you know, it's not a black and white. So we certainly encourage people to eat healthy. I think the Mediterranean diet is a good way to do that. I think it tends to be more natural and less processed, man-made things that a lot of times we don't know what that exposure risk is from many of the chemicals that we've started to put in food over the years. And so that's the reason I see, you know, many people recommending that type of diet.
Yeah, and are there particular areas of let's say the United States, aside from blue zones and hot zones, that food somehow is healthier, has less of a toxic influence on genomic, you know, and replicate, you know, on genomes than other parts of the country?
It's a great question, and I don't actually know about areas of the United States, but what I have seen is that there's data from people who move to the United States from countries like Asian countries and things like that, and that the Western diet in general, the US type of diet in general, can then increase cancer risk. You know, we eat a lot more fat, we eat a lot more fast food, we generally eat less healthy than some of the other countries, unfortunately, and so that can have an impact. I'm not sure about regions of the US though.
Right. And it's worth reminding at this point, we're still talking about genomes. We're still talking about the influence of things we put in our body on, is genomic health a phrase that we can use?
Mhm.
Okay, on genomic health, which is this, I mean, like Malecare has like, if people search on YouTube, you could find this like 90-second little animation, with the theme, everything you put in your mouth changes your life. You know, and the idea is like nothing is innocent, you know, everything, you know, it'll be a minute change compared, you know, I mean, eating an apple may or may not have the same influence as swallowing a radioactive isotope, but it's like, you know, everything changes your life. And you could go nuts with that, you know, and we don't want people to go nuts. We want people to live long and happy lives. And, you know, if it can't be long, at least it should be happy, you know. Uh, there are things in prostate cancer that people try to test out on themselves around complementary stuff or nutraceuticals, you know, different kinds of diets, you know, and you know, just unusual self-experiments, which, you know, on one hand are kind of cool, on the other hand can be extremely harmful. Um, from your experience, do you see anything that people should just not do vis-a-vis screwing up their genomic health?
I'm a big believer in science and science-backed studies, so I tend to be skeptical of a lot of those complementary types of, I'm going to cure myself because I saw this person on this group I'm in is doing it and they're doing great. I'm very much we should look at it in a true clinical trial type setting. We should be examining many of these things. You know, that's the scientist in me. Obviously there are things that can be harmful. You know, I see it in groups a lot that people will try to take sort of medicines that they don't know what they are, or that people are really looking to almost miracle cures sometimes. My personal recommendation is to discuss it with your physician. A lot of people don't tell their doctor, their treatment team, what sort of extra complementary type stuff they are doing. I highly recommend having that conversation. There's a lot of places that have sort of supportive care programs that will talk with you about complementary medicine and what things are proven. You know, exercise often comes out as one of the things that people should try to do. But I just really believe in having the conversation and being honest about what you are doing and what you're trying. And then also trying to look for anything you're interested in. Has it been tested, you know, fairly rigorously on a large number of people, comparing it to usual care? You know, try to learn about what it is before you dive right in and try it.
How does physical activity or exercise influence genomic health?
I'm it's positive in that you're getting lots of oxygen in, you're activating cells. It just kind of keeps your system healthy. I don't have all the physiology to exactly go through it, but it's generally good to keep for a number of reasons. I mean, all of your systems work together, right? You want to keep your heart healthy to then be able to react to other things. But it's just generally very, very positive and keeps cells healthy, keeps them turning over when they're supposed to be, things like that.
And so how does being sedentary, I'm probably mispronouncing that, but how does sitting on your couch hurt your genomic health?
It doesn't. There can be protective factors from the exercise. the oxygenation, the way that the cells are turning over can be good for you. So not doing anything just doesn't give you that positive boost. It also, sedentary also often is accompanied by bad diet, by many other things. So there's a lot of things that kind of play in together. That's why
Right.
this is a hard area, right? Lots of things go hand in hand, and it's not a certain cure-all. We all wish it would be like, hey, if I walked a mile every day, that would make all the problems solved. But it's unfortunately not a one-size-fits-all approach.
Yeah, and that's, I mean, it makes it exciting and fun to understand and learn more and more about. And every day there are things that astonish both of us, I imagine. I mean, it's really cool. But it also illustrates the idea there's not one, I mean, like to say, get more sleep or eat more apples or, go for longer walks, which in fact Malecare advocates through our 30 Minutes to Live program. But
All of those are good things.
yeah, but they're not, I mean, the actions are so complex as a consequence of those that you can't say walking cures cancer, or eating an apple cures cancer, or sitting on your couch makes you get cancer, or not getting enough sleep or whatever. I mean, it's like 1,000 million different things sort of working together or not working together. And it just sort of, it's not like you're throwing like a roulette wheel kind of thing, like we use the metaphor, you're putting, you throw the ball on the roulette wheel. I forget what the ball's called, and it spins around and lands on a number or a color, or even a rod. Now imagine, but the body is more like you take a handful of marbles and then another handful of marbles after that, and you throw it on the roulette wheel, and
And
then
then maybe
see
a
what.
few more after that.
Yeah, and that's how we work. That's how our bodies work. It's extraordinary. The idea that racial disparity plays into prostate cancer is critical and important, and for men of color, exceedingly important because it has a negative consequence generally to be a, where does genomic understanding help us understand racial disparities in prostate cancer?
Yeah, racial disparities is a fascinating question biologically, and I think it's really an emerging area of research. If I can sort of instill one thing, it's that I highly believe in advancing inclusive research. And part of the problem in this area is that when you look at studies, research studies, clinical trial studies across the US and across the world even, the percentage of minorities that are in these trials is much, much, much too low. So, my first push here, and I will answer your question, but my first push is that we really need to educate and improve participation in minority communities so that we can understand these issues better. We are working, GO2 is working on a project with the University of Alabama, Birmingham, where we're working in Black communities there to educate about how representation matters. So the team there's community health advisors who are locked in the community, have been talking to people who say, well, I never really understood that we needed to study people like me so that we understand why we're different, or why drugs work differently in our community, or we're at higher risk. And there's been a disconnect that we really need to make sure that all communities are participating in the same types of studies that we're seeing, largely white people who can access academic medical centers taking place in. So it's a little bit of an aside, but it's a really important one because I want to encourage your community, this is across cancers, to really think about participating in studies and how you could really advance the science for your community. So that being said, I think we do know that there are factors, there are different racial and ethnic factors that go into risk and what's happening in our bodies. There's absolutely, to your point, African American men are at higher risk for prostate cancer. We see racial disparities in many different types of cancer. There is something different about the underlying genetics and likely genomics too in the different races. We've known this for years with certain inherited diseases, right? There's certain diseases that are much more common in specific communities. You know, sickle cell is known as a more African American disease. We see Tay-Sachs and things like that in Jewish populations. There's different communities that have been hit with different diseases. I think now we really need to elucidate both the risk factors in these minority populations for different types of cancer, like prostate cancer, but also what that means on an ongoing basis. Do these groups who tend to, like you said, have more aggressive prostate cancer, do they react the same way to the new therapies that are coming out? Where does this aggressiveness come from? What's the difference in the biology? Is it hormonally driven? There's still a lot of questions that I think are being studied, but need to be studied even more.
Yeah, and let's dig a little deeper into this. There are a lot of questions, but there's also the basic thing around institutional racism. And part of the discussion of genetics versus genomics, at least in my mind, plays into that, in the sense, like, if we're looking at genetics, we're looking at, the biological inheritance of people, or not biological, what would be a better word? The genetic inheritance of people. Yeah. Genetics is about the genetic inheritance, so DNA stuff.
Yep.
Genomics takes into account where people live, what they're exposed to, what their lives are like. So when we talk about, genetics probably plays into racial disparities, where it's also an opportunity to ignore the racist possibilities that influence genomic cause disparities. Environmental stuff, opportunities for care, proper, access to healthier foods or foods without, pesticides or what have you, lead in the, in paint, go on and on. But it's interesting to me how people will talk more about genetics when it comes around racial disparities than they do about genomics.
I agree with you. I think it's a combination. I think it's a combination we don't totally understand yet, though. If you can think about how I was talking before about you need sort of multiple hits to develop your cancer. If you come in with a sort of worse genetic risk because you're from a population through, obviously all this is no fault of your own, but you're just from a population that is at slightly higher risk for developing this type of cancer. And then on top of that, you're exposed to many of the environmental factors we've been talking about today, food exposures, that type of thing, that could cause even kind of a slightly higher rate of potential changes. That just compounds the problem, right? You started here and now your rate of developing more things is here. So you may reach that, and you may reach an aggressive cancer earlier than other people. So it's a multi-level problem, I think, because you're exactly right. Many of the communities do not have as healthy a lifestyle based on where they live, things like that, socioeconomic issues, some of the systemic racism we've been talking about as a country over the last couple of months. The opportunities may be different, and so that might be sort of more strikes against you in that space. It's a hard problem. I think we don't have enough science to understand how much is which piece and where it's going. But there's a lot of people who are really interested in it, and I think it's going to be a big question moving forward, to really truly understand the racial and ethnic differences in many different cancer types. across this country and around the world.
Yeah, you mentioned radon relative lung cancer. What do we know about the aspects of military service and exposures to a variety of things relative to prostate cancer or any cancer? Yeah.
Our veterans are at higher risk in general due to exposures. It's unfortunate and another problem that we really would like to address. We're doing some work with the VA to try to educate around, for us, lung cancer screening as well as other things, but also to make sure that veterans have proper support. There are known examples. I think Agent Orange is a great one of specific exposures that then lend to higher cancer risk. But there's also a lot of unknown exposures in the field, things people may have been exposed to at lower levels, smaller levels that are less likely, less data on, I would say. We know exactly how it might have affected the genomic health of those who served in our military. The VA is doing a good job of trying to understand some of this. They have a Million Veterans initiative now that you can participate in to sort of track veterans over time and to try to help to understand some of these risks and what is happening in this population. But I definitely would tell everybody who served in our military to make sure to kind of keep up with your health, general checkups, things like that, screening, because in general, unfortunately, the data shows that they likely were exposed to things that the normal civilian population was not. Particularly depending on where they served and if they deployed and if they were at war. There's a lot of things that go into it, but it is a concern, and they should make sure they're doing regular recommended screenings, having conversations with primary care doctors, things like that.
Yeah, and those of us who have been in conflict zones know it's not just the exposure to within service, but to the population around us and those we were attacking or trying to help. They were exposed in ways that service people, were at least monitored about. Populations affected by service activities are rarely monitored and are left exposed, and their health is impacted in ways that we'll never know about. There are examples of young girls in Iraq presenting with breast cancer, prepubescent breast cancer, extraordinary stuff. The idea of focus on racial disparities, military exposures. We should also mention farm workers, people on Native American and First People reservations, and so pretty much anything that seems unique and less talked about than just the common experience of men and womankind throughout the world presents its own unique opportunities for genomic disruption in a negative way.
Absolutely. We've even seen stuff like in Asian countries, women who are constantly cooking over interesting fumes and things like that. And anything that's sort of not everyday life, and even things that are everyday life, I think pollution in the air, stuff like that are things we're monitoring to really understand what that looks like. In certain countries, we may see higher cancer risk because of more pollution, those types of things. So to your point, there's lots of different potential exposures, and we refer to it as occupational exposure. We do have a big focus on the military, but occupational exposure is one of the things we talk about as a risk factor for lung cancer, because you're exactly right. It's not just military exposure. Your occupation can where you work can put you in contact with types of fumes, with chemicals, with things like that, and all are things to watch out for.
Yeah, and occupation should include like what things that are not typically, are just beginning to be understood as occupations, like housework.
Yep.
Like childcare, things like that. Talcum powder, on a baby's butt, things that we're only just learning, that intuitively, probably everyone knew inhaling that stuff was not a good idea. But until somebody actually puts a warning label on a product, we really don't have, like, give ourselves permission to change our habits and say, no more talcum powder, you know?
Yeah.
Yeah. And medications too. I mean, how long ago were we using leeches, or I don't know what else, but bad stuff. Mercury, wasn't mercury healthcare. Uh, as we close out this really interesting conversation, let's talk a bit more about what do you think patients with prostate cancer should be talking about with their doctors vis-a-vis genomic health.
So I think a few things we've touched on already: what exposures you have, what your risk factors are. Does where you live, where you work, your race and ethnicity play into your risk, and what the best things moving forward are? I think, just to veer off in a slightly different direction for a minute, there's a lot of emerging information about the genomics of your cancer and how it should affect your treatment. So lung cancer is probably a little bit ahead of prostate cancer in that we now have 8 or 9 different therapies that are approved for lung cancer only if you have a certain genomic change in the cancer itself. So they're testing. In our community, we're advocating for everyone to get genomic testing to really understand the cancer itself to help your treatment plan. I think that's starting to come in prostate cancer as well. There's a lot of hormone receptor type biology that is understood well in prostate cancer. There's some new drugs around DNA repair mechanisms and things like that. There's also some drugs now that are rare, very rare in prostate cancer, and rare in lung, and rare in other types. But if you have a certain gene fusion that generally did happen environmentally, a good example are these genes called NTRK. If you have a gene fusion, there's a drug for that now, no matter what type of cancer you have. It's a new type of approval from the FDA that it's a really rare event. But if they find it, there's this great new class of drugs that you could go on. So I think genomics is really coming into not only the risk space, but also the treatment space. And I think everyone should have informed conversations with their physicians about the risk side and what can I do to stay healthy, and what things can I do to maybe keep me healthier during this time, or if you're actively watching and waiting, or if you're undergoing therapy. But also to ask about, should I do any type of genomic testing, and would that impact what my treatment plan might be going forward if you're diagnosed?
Well, you've certainly helped all of us have a better informed conversation with our doctors, and I thank you for that. Dr. King, thank you very much for taking time with us, giving your time to us, and welcome to our conference.
Thank you so much. I'm thrilled to be able to do it.
Yeah.